So do you think that if any cancer is running in the family and the next generation is definitely going to get that, or is there any way that we could prevent that?
Well, I think there are two aspects to the genetic aspect. One is, is cancer a genetic disease? Yes. Because unless there is a change in the gene, cancer cannot happen. In that sense, it's genetic. But running in the family is what you're talking about. It talks about hereditary cancer, right? So hereditary cancer is basically, if it, for example, we have all heard about Angelina Jolie effect. She was diagnosed to have BRCA gene mutation. So she underwent a prophylactic breast cancer surgery, and she also underwent prophylactic oophorectomy for prevention of ovarian cancer. So that's because in her family, her mother, her aunt had this ovarian cancer, and the BRCA gene was positive in their family. That's why she underwent a prophylactic surgery.
Yeah.
So given that if in a particular family this BRCA gene is positive, then we discuss the options of risk reduction strategies. Right? Other than that, overall, I think for the common public, hereditary cancers need not be a big concern in that sense, because if you look at the total number of cases, about 5 to 10% only are hereditary.
Yeah. And the rest all are?
Rest is all sporadic.
Yeah.
About 70%, I would say, of them is environment and, the lifestyles.
Are there any preventive measures that we can take apart from screening, which is very important, I believe? And what are the preventive measures that you would like to?
Yeah, prevention, I think we all know is better than cure, right? So, how do you prevent cancer? Can we totally make sure cancer is not going to occur at all? Absolute prevention is not possible, right? But majority of the cancers, for example, cervical cancer, in our lifetime we can prevent cervical cancer.
Yeah.
Because we know the cause. We have a simple vaccine. So there are two vaccines to prevent two cancers. Hepatitis B virus vaccine and human papillomavirus vaccine for cervical cancer. So two cancers can be taken care of if we take two vaccines. So other than that, what else can we do to prevent cancer? Probably, I think change in lifestyle is number one. I think, physical activity, right? Healthy diet, right? Consumption of more fruits and vegetables, right? So all this modification of our lifestyle.
So what screening methods that you would recommend for us to follow, especially after you hit a certain age?
I think screening is very essential thing, not to prevent cancer, but to detect cancer very, very early, even before you have symptoms. So in that way, it could be one of the prevention strategies. Because we are detecting something which did not manifest or which is not going to manifest in the near future. Right? So given that, I think based on the age group, for example, any women above 40 years of age, get an annual mammogram, an X-ray of the breast for breast cancer screening. Okay, and then monthly once you can do a self-examination. Be self-aware of your breast. Note for any changes. So similarly for cervical cancer, we have pap smear after the age of 35. Right? From 20 to 35, we can do pap smear once every 3 years. If you do HPV testing, the human papillomavirus testing, we can do once in 5 years. So similarly for men, we have prostate, we have a tumor marker called PSA. So above 50 years of age, get simple serum PSA done. Right? So like that, for most common cancers, screening is not for every type of cancer. So if you are above 50, get a colonoscopy done once every 10 years.
Okay.
So if it is normal, you don't have to worry for the next 10 years. So in that way, I think, screening does help in saving lives. Mammography has proven to save lives. So I think I strongly recommend to all our viewers to consider cancer screening as part of their health checkups.
But do you think that most of the patients, what you have seen about awareness, do you think that they believe about screening, or how do you see that this trend has changed, especially in your 2 decades of your clinical experience?
No, I think the question is very relevant. I don't see any change because there's not big take. The screening for cervical cancer is not even 2% in rural area, not even 5% in urban area. Even for breast cancer, less than 5%. So even the educated are illiterate in that sense.
Correct.
So in that way, I have not seen any significant alteration in the trend for screening and adoption of screening. It's not picked up. I think we need to sensitize the communities at large. I think a programs like this, what we're doing, I think this will go a long way in communicating the right message.
Correct.
Not to cause fear, but to make them well informed and take a right
decision. Should be aware of, because cancer is totally preventable, and if detected at an early stage,
I would say majority is preventable.
Correct. And detection at an early stage is also of paramount importance.
Absolutely. The outcomes of cancer treatment depends on the stage. Early detection helps in cure. One statement I want to make here, Lakshmi, here is because people always compare the results in the West. The cancer treatment is very good in the West, outcomes are extremely good. Honestly, the majority of the results are good there because most of the cancers in the West are detected in early stage. 70 to 80% early stage detection happens in the West. It is just the reverse in India. 70 to 80% we see in stage 3, stage 4.
Oh,
That's why we don't have good results, and we think that maybe we are not managing well, or we don't have a best infrastructure to manage or equipment to manage. India has the best infrastructure healthcare wise. The capacity is wonderful. We have the excellent doctors. See, today the cancer care is universally same in that sense.
Correct.
The access to the best of the best medicines, the best of the best technology. See, for example, we have my MR Linac.
Yeah.
Right? We have the latest robot, Da Vinci X, right? So this is possible, and it is available, and so at far and at much less cost, right? So in that way, a low cost, accessible, world class care is available today. So I think the most important thing that I want to convey is that early detection is very much essential, and people should come forward for screening and get it detected very early.
So before we wrap this episode, doctor, is there any message that you would like to share with our audience?
I think the message is very clear. Cancer is not a death sentence. Cancer is curable. If we detect cancer early, we can completely cure the disease in majority of the cases. So eat healthy, make your life choices very, very clear in terms of physical activity. The modifiable risk factors, physical activity, less consumption of alcohol, have a healthy diet, and avoid tobacco. I think if we can do this, you're doing a lot of good not only to yourself but to the nation at large.